Today I'm going to be telling you everything you need to know about hepatitis, the signs and symptoms of hepatitis, the causes of hepatitis, the treatment of hepatitis, how to prevent hepatitis, the chronic and acute stage of hepatitis. My name is Pharmacist Rubby. If you find this video interesting, stay to the end. Now, let's get into it. Now we have two different types of hepatitis, the viral hepatitis and non-viral hepatitis. We are going to start with non-viral hepatitis. Non-viral hepatitis are hepatitis that are not contagious. It's not contagious. You cannot contact it from the person that has it. When your skin touches the person's skin, the person cannot give it to you. You cannot get it from sex. You cannot get it from blood contact. Now, how do you get it? There are different ways you can get non-viral hepatitis. One, we have drug-induced hepatitis. Drugs like paracetamol, when you abuse them, it can damage your liver. Remember, hepatitis means liver damage. We also have the ones caused by toxins. Toxins like herbal products. When you abuse herbal products, they can damage your liver and cause hepatitis for you. We also have autoimmune hepatitis, when your immune system attacks your liver and causes hepatitis for you. We also have alcohol induced, the ones that are caused by alcohol abuse. Okay, when you abuse alcohol, it can damage your liver and cause hepatitis for you. All these are called non-viral hepatitis. Now let's talk about viral hepatitis. We have different types of viral hepatitis. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis D. And they are all different. They can be gotten differently. And the treatments are different too. Now, hepatitis A is gotten through oral fecal route, through contaminated water, contaminated food. That is how you get hepatitis A. Hepatitis A can be prevented through vaccination. It has vaccine. And it has only acute stage. It cannot transform into the chronic stage. You can only see it in acute form. Now let's talk about hepatitis B. Hepatitis B is caused by hepatitis B virus. It can be gotten through sexual intercourse, blood transfusion, unscreened blood transfusion, blood contact. When you use sharp object with someone that has it, like needle, razor, yes, you can get it. It can also be gotten from mother to child during childbirth. These are the way you can get hepatitis B virus. And it can be prevented with vaccine. Yes, it has vaccine. So go and get vaccinated. Another thing is that hepatitis B can transform from acute stage to chronic stage if left untreated. Now let's talk about hepatitis C. Hepatitis C cannot be gotten through fecal oral routes. No, you can only get it through blood contact. It can be gotten through blood contact, like sharing needles and razor with the person that has this hepatitis. And again, it can be gotten through unscreened blood transfusion. It is rarely gotten through sexual intercourse. In some cases, it can. Another one is hepatitis D. Hepatitis D cannot multiply on its own. You can only see it in someone that has hepatitis B virus. Yes, that is only way it can multiply. Now let's talk about hepatitis E. Hepatitis E is gotten exactly the way hepatitis A is gotten. They are both gotten through oral fecal route, through contaminated food and water. What are the signs and symptoms of this hepatitis? We have yellowing of the skin and eyes. When you start noticing that your eyes and your skin is turning yellow, visit a doctor. Another one is dark urine. The urine will start turning dark. Your stool will become pale or clay color. Another one is that you start losing appetite, start feeling tired, fatigue. And again, you will start noticing abdominal pain. Your upper right abdomen will start paining you. These are the signs and symptoms of hepatitis. Now, how do you prevent hepatitis? One, by getting vaccinated. Go and get vaccinated. You have vaccine for hepatitis A and B. Drink clean water. Cook your meat and food properly. Wash your vegetables properly. Another one is practice safe sex. Yes, it's going to go a long way. Practice safe sex. Stop sharing sharp objects. Stop using toothbrush with someone. No matter how much you love the person, get your own toothbrush. Get your own razor, your own needle, even clipper. Stop sharing clipper. Get your own clipper. These are the ways you can get hepatitis. So prevent them by getting your own. So these are the way you can prevent hepatitis. Let's talk about the acute and chronic stage of hepatitis. When is hepatitis acute and chronic? Hepatitis is considered chronic after the first 6 months, okay? After the first 6 months, if it did not resolve or if left untreated, it can transform into chronic stage, okay? So the first 6 months of hepatitis is called acute stage. Then after 6 months, it will transform into the chronic stage. Now, how do you treat hepatitis? Hepatitis A and E, they are self-limiting. They go away on their own. Remember, they only have acute phase. They don't have chronic phase. Yes, they go away on their own with proper rest and hydration. Yes. Then hepatitis B is treated with antiviral drug. Hepatitis C is treated with direct targeting antiviral drugs. There are drugs that are called direct targeting antiviral. Now, hepatitis D is very, very difficult to treat. Very difficult. Remember, I told you that you can only find it in someone that has hepatitis B. For now, you can only use interferons injection. Okay? That is the only thing that can be used for now to treat hepatitis D. Now, I hope you learned a lot from this video. If you notice all these signs and symptoms that I just mentioned in your body, please go and visit a doctor. Rush immediately and visit the doctor. They will diagnose and treat you properly. Hepatitis can be treated if you find out on time. Early detection is key. If you learn something from this video, share this video. Share it to your friends, your sisters, your colleagues at work, your friends in school. And don't forget to subscribe. We'll see you on our next video. Bye bye.